Okay, so what we're going to take a look at in this video is some more emphasis on that Quadratus Lumborum, that QL muscle that's back here, that's again sits right on top of that pelvis, attaches to the top of that pelvis and to the bottom of that last rib down there. And it's in that region, kind of off to the side of the low back. And again, one of the muscles that tends to cause us to have some low back pain. So what we're going to look at again is the soft tissue work or some mobilization of that muscle back there. And what we're going to do is we're going to work on this area right in here. So it's kind of at an angle. It's not directly right off to the side of that spine. It is off at an angle in this area right here. So when we're lying down, we have to kind of go in at an angle and not directly on that tennis ball or whatever implement you may be using. So to do that soft tissue work, we're going to floss or strum that area. And again, it's kind of going in at an angle, and I'm lying back. My hips are tilted to the side just a little bit. And in that area, you can kind of ride up and down on that tennis ball a little bit, and you're going to find some hot spots, trigger points in that muscle. And when you get there, we're just going to kind of hold on that area, kind of give me some deep breaths. Try to let the glute go, the quad go. We tend to hold those real tight. Relax on that area. While we're there, you're then going to floss that area by pulling that hip up and then extending out. So as we pull up, we're going to try to kind of rotate that hip up and in. Pull it. What it's doing is pulling that pelvis down and get some stretch on that QL, that Quadratus Lumborum, and then I'm extending, turning that toe in. So pulling it in and extending out. So I'm actually flossing and strumming that muscle back here over top of that tennis ball. After you feel it loosen up a little bit or that trigger point get in, you can floss a little bit more on that ball, and you may find, just like that, I've got a little spot there. We're going to hold there. We're going to breathe for a second. Then I'm going to strum that guy out again, right there. Now, after you do get some alleviation back here, a little bit of relief in that QL, if you would like to make it a little more intense, you can then slide out and relax. You can go arm overhead, leg is long, and I'm just relaxing right there. But you can also floss or strum that muscle up and down as you're in this position. You find your nice little trigger point, hot spot. You can just relax into that tennis ball, relax the glute, relax the quad. Try to relieve all that tension you got up in the chest and breathe and just hold on in that area. So those are two ways to really get at that QL, that soft tissue work. It's really deep. We have to go through some layers of tissue to get to that QL. That tennis ball works nicely. If you're at a gym or a location that doesn't have a fancy little tennis ball or a golf ball or lacrosse ball, you can find anything that's kind of blunt on the end. And again, this is going to be a little more intense. It's a harder rubber. It's a little bit more narrow than that tennis ball. Same concept. I'm going to go at that angle. I'm going to find that QL right in there. And it's going to, if you tried several different type of implements to do this, you're going to find that one is going to be more intense than the other, and it's going to feel drastically different, but you're going to feel that QL kind of in the same spot. And I'm going to get there, and I'm going to floss on it a little bit right there. Breathe through it, trying to get that muscle to relax. So same concept, just using a different implement. Anything that you might have at the gym, you may want to work on both sides. See if you can't get a little bit of alleviation in that back pain that you may be having. And it just feels really good to those hips overall when that QL is nice and loose and mobile. You don't have to specifically have back pain. So try that out, check back, give you a few more stretches next week.